Welcome to the Module 7 Team In-Service. Interprofessional language does more than communicate messages and intentions. This week, we will discuss the impact of profession-specific jargon and team member inclusion and exclusion. Communication is a vital part of any team interaction. In healthcare, communication is the oil that smooths team relationships and fosters team collaboration. Ineffective communication can be the downfall of a team, and effective communication can make healthcare teams great. As with anything done well, it takes intention and effort. Communication is important because it does more than share key information. Between team members, it builds and sustains relationships, provides constructive feedback, and sets the tone for team interactions. Appropriate communication can ensure understanding and clarity of the mission, tasks, and expectations. Communication allows us to make decisions, establish and clarify team roles, and get things done, such as planning or implementing a task. You likely know that verbal communication is comprised of spoken, signed, and written language that conveys specific information. However, even when specific language is used, the meanings can be misinterpreted, as in the 5 variations of the word to. Non-verbal communication is messaging conveyed through every means except language, such as facial expression, gesture, voice, posture, body positioning, eye contact, paying attention, and physiological responses. Just take a look at these communication statistics. The importance of non-verbal communication cannot be overstated when we realize that 93% of communication effectiveness is non-verbal. Communication impact determines whether we get our message across correctly or not. Only 7% of communication is received by the words we use, while voice quality adds another 38% impact. Non-verbal communication accounts for 55%. That's over half of our communication impact when we send a message. Is it any wonder that communication is one of the hardest things to master in our interactions with each other? Multicultural differences in body language are another great potential for non-verbal misinterpretation. In healthcare, there is an added layer of potential for misunderstanding and misinterpretation. What happens when professionals use their own different languages with each other? Jargon is the language used, especially the vocabulary peculiar to a particular trade, profession, or group. It is also defined as unintelligible or meaningless talk or writing, gibberish, or any talk or writing that one does not understand. It is language that is characterized by uncommon or pretentious vocabulary and convoluted syntax and is often vague in meaning. Jargon can be socio-cultural, such as common terms in everyday language, and it can also be profession-specific. We will analyze the use and purpose of interprofessional jargon. Let's reflect on the 3 questions. Why do we use jargon? How do we use jargon? And who uses jargon? Why do we use jargon? Jargon is used to include those in our profession or team and to exclude those outside our profession or team. It is used to hide information from others and also to hold the power on a team. Sometimes it is used to express profession-specific descriptions, especially in assessments and interprofessional meetings. Lastly, jargon allows us to indicate our knowledge. How do we use jargon? We use jargon in formal and informal meetings. It is seen in documentation. We use it in verbal communication like S-bar. Jargon can be found in emails, texts, and in phone messages in referrals. Jargon appears in all forms of communication. Who uses jargon? All professions have their own specific jargon terms. This has caused a shift in healthcare facilities where they are developing their own list of limited, approved jargon terms. Along with this, education is provided to highlight the complications of miscommunication and the risk to patients and staff safety when jargon is used. In addition to patient and staff safety, why do you think healthcare facilities are beginning to actively restrict the use of jargon terms? Take a moment and think about times when you have encountered jargon, whether socially or at work. How did it make you feel? Have you seen how it makes other people feel when they don't understand what has been said to them? How do you think patients or family members might feel if the language is not familiar? Perhaps you've seen confused looks on their faces when you have inadvertently spoken to them using words they didn't understand. Can you imagine being sick and at your most vulnerable and not knowing the important communication that is being directed at you? As a healthcare provider, can you relate to feeling excluded in a conversation that you thought you were a part of? What might you do if you didn't understand jargon? How might you seek clarification, and why would you need to? How can you role model effective communication? Asking for clarification for unfamiliar jargon terms may cause you to feel unsure of yourself. You might feel you give the impression that your professional knowledge is limited. When we are proficient in our own professional knowledge, we don't want to come across as being unknowledgeable. Here are some examples of ways to ask for clarification, and if you do this, you will likely find that other members of the team feel more confident asking also. You could say, "Please could you rephrase what you said? I am not familiar with that term, word, acronym." Or, "I didn't understand that term. Please could you explain what it means?" The question I like the best is, "That is a jargon term I am not familiar with. What does it mean?" I like this question because it identifies another person's use of jargon that they may not have been aware of and gives them the opportunity to create inclusion. Why do you think you need to seek clarification? Clarification is important in order to fully understand the language and communication exchange. Imagine working in a healthcare setting where everyone spoke a language you didn't understand. Safety would be the greatest risk. Clarification ensures the safety of patients. For example, in an emergency situation, all staff must understand each other. To ensure staff are safe, for example when transferring patients, information needs to be explicit. Clarification will allow staff to feel fully engaged in team communication and dynamics. It enables team members to be able to support and interact with each other. How can you role model effective communication? You can do this by knowing the approved jargon terms used in your facility. When in doubt, do not use jargon. Ensure you understand all communication and practice being assertive when asking for clarification of unfamiliar terms. Keep notes of new terms and their meanings. Knowing which profession uses specific terms can also help to understand their roles and responsibilities. Support others who may be new to the language used. It might be obvious to you that a member of the team doesn't understand a particular term, and providing an explanation can help them feel confident to ask for clarification themselves in the future. Remember that communication is a two-way system. Both the sender and the receiver are responsible for the effective transmission of a message. To avoid using jargon yourself, always remember who you are talking to, and be sure to be concise in what you say, be clear in how you say it, and give the complete message. Thank you for attending this in-service. Communication can be a challenging process, and mastering it is a lifelong journey. What you learned this week will help you reflect on one of the basic forms of miscommunication and misinterpretation, encouraging you to think before you speak and doing your part in including others in your conversations. Having a clearer understanding of the impact of jargon on our patients is beneficial when you consider the questions of the Module 7 case scenario and the unfolding scenario questions in the coming weeks. In addition, you will be able to apply what you've learned in this in-service to the Test Your Knowledge quizzes and activities. See you at the next in-service and have a great nursing shift.